So the first ligation technique that I want to demonstrate is something called a circumferential ligature. As the name suggests, this encircles or goes around a structure, so a pedicle or a blood vessel, etc. And that's the basic construction of the circumferential ligature. So we wrap a piece of suture around the structure to be ligated, and then secure that piece of suture with typically 4 throws, perhaps 6 throws, if we're very concerned about that ligature. But 4 is pretty common. So 4 throws, 2 square knots. The way to wrap that ligature around the structure is by placing your needle driver under or to one side of the structure. So in this video, I'll place it under this suture board or this ligation board. I'll open the jaws of my needle driver and I will place the ligature, or the piece of suture, excuse me, in the open jaws. I'll close them. I'll pull that strand of suture back underneath and around the structure to be ligated. Now, what I commonly see here is students will release this and they will begin their series of throws. So they'll wrap, and as they wrap, they'll pull that ligature back and dislodge it from its position. So that's an area where we can definitely improve. So instead, we're going to repeat that process. We're going to grab that suture material, we're going to pass it back under the structure to be ligated, and with this left hand, we are going to form a kind of a finger gun, and we're going to wrap that piece of suture up and over the back of that index finger of my left hand. With my right hand, I'm going to bring this suture material up and over and crisscross my left index finger. I'm going to pinch with my thumb, release the free end of the suture material, pass my needle driver through the loop that I've formed, open the jaws, grasp the tail, pull it back through the loop, and you can see there I've formed 1 throw. We'll tighten that down. And from here, the process is similar to tying a square knot. We've got a V of suture. We keep our needle driver in the center of the V. Single wrap, grab the free end, and roll it through that loop that we formed. And from here, you can stack on however many throws you think is appropriate. If we wanted to do a circumferential ligature, but with a surgeon's throw to begin with, we would start in the same manner. So needle driver under the structure to be ligated, grab the free end, pull it back through or around your structure to be ligated, make a finger gun and have that loop of suture up over that left finger, crisscross, pinch, through the loop, grab the free end and back through the loop, but instead of releasing, reoppose your thumb and your index finger to pinch that throw again, and just repeat that process. Go back through the loop, grab the free end, and pull it back through that loop. And now we've got a surgeon's throw, okay? And then we can stack throws on top. Important to remember that a surgeon's throw does not contribute to knot security in the same way as a standard throw, meaning that if you begin a ligature or any knot with a surgeon's throw, we want to make sure we have an additional throw on top of that. So if you start with a surgeon's throw, you have to put 4 subsequent throws on top of that. Okay, the second type of ligature that we'll talk about is something called a transfixation ligature. A transfixation ligature involves incorporating the structure to be ligated within the knot itself. So we'll begin by taking a bite through the structure to be ligated and pulling that strand of suture through. We'll leave ourselves a few extra centimeters here because we're going to be using more of this suture material. From here, some surgeons will tie a square knot on one side. Other surgeons will just do a single throw. I like to do a single surgeon's throw as opposed to a square knot. And then we wrap that whole suture material around the structure to be ligated. Okay, so now you can see that that entire suture material is wrapped around this structure. From here, we construct the rest of our ligature in a very similar manner to the circumferential ligature. I like a surgeon's throw here, so I can keep my knot exactly where I want it. If you don't need a surgeon's throw, that's fine too. You don't have to put one, but I like a surgeon's throw. If we're gonna put a surgeon's throw, we wanna make sure we have an even number of square knots applied on top of it.